My name is Dr. Vivien Brown. I'm a family doctor in Toronto, Ontario, and it is my pleasure to introduce the launch of ResilienceRx powered by The Rounds. What this is all about is having an opportunity to talk with each other, to understand and learn from each other, and to support each other as physicians. We know that healthier doctors means healthier patients. I think it's a fact that needs to be shouted from the rooftops and spread throughout healthcare systems globally. And with the COVID pandemic, we've seen riskier workplaces. The environment for physicians has become even more important as we are working to protect not just our physical health, but our mental health and the health of our companions. Mental health has become less taboo. We are witnessing a shift in the focus towards physician burnout. And this shift has resulted in shared responsibility of ownership between individuals and the healthcare system. I think we need to do our part to take responsibility for promotion of physician health and physician mental health across Canada. Joining me today, I'm honored to say, is an extremely important individual, an extremely passionate advocate for physician health and wellness, Dr. Gigi Osler. Dr. Osler is a past president of the CMA. She's the president-elect of the Federation of Medical Women of Canada, an organization which has part of my heart. She has co-chaired the Physician Canadian Conference on Physician Health and served as the inaugural chair of Physician Health and Wellness Committee for Doctors of Manitoba. In 2017, she was awarded the Doctors of Manitoba Health and Safety Promotion Award in recognition of her efforts to develop and implement programs to help the health and well-being of doctors. Thank you so much for joining us, Dr. Osler. I'm really honored to talk with you this afternoon.
Dr. Brown, Vivien, it is just an absolute pleasure to be here with you, and I am delighted to be talking to you about a passion of mine, which is physician health and wellness.
So with your permission, I'm going to call you Gigi because I feel like you're a friend. And it's interesting. It's not that I know you that well, but I do know your work. And through your work, it feels to me like you are a friend. So you've been a passionate advocate for physician health and wellness. So what steps have you taken to protect the mental health of your physician colleagues and companions?
That's a great question, because historically, physician health and wellness has taken a backseat to other issues. And we know that the stigma associated with mental health is alive and well, and especially for physicians. And, if you are suffering from symptoms of depression and you're not a physician, most people will reach out. But for physicians, we know the opposite is actually true. And the more depressed you are as a physician, the less likely you are to seek help. And so I think having conversations like this, normalizing the discussion about health and wellness and the challenges that we face as physicians, helps to overcome the stigma and normalize health promoting and health seeking attitudes and behaviors. I think providing peer support, having conversations like this, being open and willing to speak with colleagues who may seem to be struggling under the challenges we all face, but maybe not opening up. And all of this, I think, is something that we can do to help reduce the burden of physician ill health and sickness within medical culture.
You phrased that very eloquently, because I think that is just so important. I almost feel it's easier to talk about wellness than it is to talk about mental health. You decrease the stigma by reframing it as talking about wellness.
Mm-hmm. Sorry, go ahead.
No, that's okay. Please comment.
Okay, completely agree. I think, promoting wellness is important, but I think acknowledging mental health struggles, acknowledging mental illness, acknowledging the depression, the anxiety that we all face as human beings, but especially as physicians, there's a balance. There's a yin and a yang. You can't acknowledge the wellness without acknowledging the unwellness that we all face.
Mm-hmm. For those of you that don't know, Dr. Osler is an ear, nose, and throat surgeon. And certainly surgery has been a risky business in the time of COVID, as have other areas of medicine. The environment in the workplace is risky. What should physicians do to manage the stress and their mental health at this point in time?
You know, with the pandemic, I think it really has exposed a lot of the cracks in our healthcare system. So cracks in terms of access, care for our patients, PPE supply, all of that. We have seen our colleagues rise to the challenge of the pandemic and go above and beyond and provide care beyond, I think, what any of us thought we would be called to do. And we came into this pandemic knowing there was an epidemic of physician burnout to begin with. So as I see all of our colleagues work harder than they've ever been before, sacrifice more than they've ever sacrificed before, I think we all have to be very cognizant that once the pandemic is over, we need to be able to acknowledge and support any increase in burnout, PTSD, anxiety, and depression that may come. You know, that fourth or fifth wave that a lot of physician health experts are talking about. And so, you know, while I see our colleagues working hard right now, I think everything we can do to help support them as peers, as colleagues, is vitally needed right now. I would encourage us all to ensure that our health systems, our work environments, our training environments are there to provide the support that will be needed once the pandemic is over and wait lists have to be caught up on, diagnostic tests need to be caught up on. Because once the pandemic's over, the work isn't going to go away and it's not suddenly going to be easy vacation time. There's a backlog of work that will need to be done. So I think we as colleagues need to keep an eye out for each other. We need to keep doing what we can to stay healthy and well. But I think we also need to hold our health system accountable for the healthcare providers working in it.
It's interesting because I think there's a sense of holding your breath until COVID finishes and then it'll, quote, be all right. But as you so rightly described, there will be some post-traumatic stress as we work and try and, quote unquote, catch up for all the things that we haven't been able to do and all the patient issues that have been delayed and postponed. So I do think that this is an ongoing issue. It's not an issue with a clear start, and it's not an issue with a clear finish.
Agree. And, you know, I think if we look back to pre-pandemic times, it wasn't great before the pandemic. And now the pandemic has got everybody working harder and faster than they've ever worked before. So when the pandemic eases up, are we going to go back to the way we used to work? Are we going to go back to the system that we had before? Or are we truly going to build back better, as so many people are talking about? And building back better, I think, has to include improving the experience and health and well-being of all healthcare providers.
What do you think physicians can do right now to mitigate burnout? What do you think are some of the strategies that we should be doing for ourselves and we should be encouraging others to do?
It's a good question. And let me share something with you. So in 2017, when I was CMA president-elect, we released the first physician health study that had been done in about 10 years. So we surveyed physicians across the country, and we surveyed physicians on both negative health impacts and positive health impacts. So we asked about burnout, we asked about risk of depression, we asked about suicidal ideation, and we found significant levels of all three. So pre-pandemic, there were significant levels of burnout, risk of depression, and suicidal ideation. We also screened and asked about positive factors, such as resilience, which can actually be measured. And we found high levels of resilience in Canadian physicians and residents. So while that may seem odd, if people are burnt out and having high rates of suicidal ideation or at risk for depression, how can they be resilient at the same time? And I interpret that to say that we are, as a profession, we are doing what we can to stay healthy, to stay well, despite all of the challenges that we face working in healthcare. But there must be other factors at play. And I think those other factors are the systems in which we work, our training environments, our work environments. So when I look at that, I have faith, and I think we see it right now in the pandemic with how hard people are working. People are resilient. I would encourage all of our colleagues to continue to stay physically well, emotionally well, psychologically well, mentally well. Keep looking after all of that. But at the same time, we still need to hold our systems accountable. We still need those changes in our working and training environments that were needed before the pandemic, but even more now. So I think the short answer is keep doing what you've always been doing. Look after yourself, practice self-care. But we collectively still need to advocate for change in the system.
And I think it's interesting that at this particular time, we've lost some of our social connectedness, because we're not in large groups and we're not going to meetings and we're not hanging out in hospital corridors. Mm-hmm. That social connectedness that always helped us to feel part of something has been gone. And yes, Zoom is terrific and we do lots of virtual meetings. And I think that's here to stay for a variety of reasons. But I think that one-on-one social connectedness with colleagues or partners or family, I think that is really missing. And I think people are missing that across the board.
Very much so. And I would agree with you. While virtual meetings has been really a professional saver for us, and it has also encroached into that personal time as well. So you can now do meetings all over the country, 12 hours a day, because of virtual meeting setups. So it's a double-edged sword in that I think we have that ability to connect via virtual means, but as human beings, we are missing out. And I think a lot of us are craving that face-to-face human interaction.
Yeah. I think we've lost boundaries. It's very hard to not look at results on a weekend and not call people as a family doctor. I call people Saturday, Sunday. I want to tell them their COVID test was negative or their COVID test was positive. Nothing waits till Monday morning. Mm-hmm. It's, you work 24/7 in a sense because everything keeps on happening. The boundary of office hours is gone. Mm-hmm. Right? Office hours is lost when everything is by email and online and virtual.
Very much so. And I think as we continue to incorporate virtual care in our practice post-pandemic, it is going to have to be a real rethink of how do we fit it into our workflow and how do we reset those work boundaries so that work doesn't slowly encroach on and take over our lives.
Which it often does and has been in the last little while. You can't watch anything on TV without hearing about, which COVID vaccine has been approved and what the issues are and what NACI has said. And, that constant bombardment of work and work-related issues, I think does contribute to burnout. There's no downtime.
Mm-hmm, mm-hmm. And that's where I think the practicing self-care, trying as best you can to carve out some time in your day for you to not only feed and refresh your body, but feed and refresh your mind and your soul at the same time.
All right. So you can stop me if you want to, but I want to know, what does Gigi Osler do for herself following that advice? What do you carve out time for you to do to decrease the intensity and the the stress in your life?
So like many physicians I know, I am my own worst patient in that I will work myself after hours, on evenings, late night emails, late night meetings, working on presentations, and not do the self-care that I know I sometimes need to do. So I know I will work late and skimp on my sleep. I know a lot of my coping mechanisms are not good. And so my coping mechanism, and it really came to light at the beginning of the pandemic, is stress snacking. So last year, I can't tell you in March and April how many bags of potato chips my house went through, because I would find myself doom scrolling through Twitter, eating potato chips late at night. Was I exercising as much as I should? No. And I acknowledged that, forgave myself, said, okay, it's a stressful time. We're working hard. It's very stressful. Once things quieted down a bit, I made a conscious effort to try to eat healthier and to try to exercise more. And so I know what I should do. And I try to sleep more regular hours. But I will be the first to acknowledge that I am my own worst patient and will fall by the wayside and lean more on my bad habits, which are benign compared to others, eating too many potato chips late at night. But I've come to recognize those as my own early warning signals. Okay, I'm obviously stressed about something and my mind is racing because I know I'm doing this, I'm doing that, and I'm not doing enough of that. So it's at those times where I've learned to try to reset myself so that I don't tip too much into stress, snacking all the time and not exercising. And that's your Gigi confession for today.
And I think sometimes we think it's selfish to take time for ourselves, that it's selfish to take time out of the busy day and, not answer calls or not answer demands. But actually taking care of yourself is selfless so that you'll be healthy and well to take care of everybody else. So if you have the insight to recognize your early warning system, and maybe it's, snacking potato chips, it's great that you've got the insight to recognize that. I think part of the issue when physicians are stressed beyond their coping level is that they don't often recognize that working more may be the stress that they're not seeing as being a stressful behavior.
Mm-hmm. And, if I think back to the attitudes, behaviors, and culture of medicine, there is always the do more, work harder, do more, work harder. That's what makes you a good physician attitude out there. And the pervasive attitude for so long, and even now, is selfless behavior. Put your patients, your work ahead of any needs you may have. And that feeds into the physician personality a little bit. I think we are all driven personalities, and we have learned over the years of pre-med, med school, and work on how to cope and continue to push ourselves with little sleep, little exercise, not much food, not much time to ourselves. But as our work lives get busier, as medicine gets busier, as our patients get sicker, as the demands on our time and our expertise grow, there can be a point where those habits that you've ingrained for so long will no longer sustain you. And that's often where I think, we hear about colleagues who just have to take a step back, take a break, cannot keep up that pace anymore. And, we as a society, beyond just medicine, I think like to laud and honor those who push themselves beyond the limits, and they're the best that they can be, which sometimes leads to unhealthy expectations of all of us. And, really, we should be commending those in our profession and those in our society who are looking after themselves, who are setting healthy boundaries, who are present and mindful of their family or their lives outside of medicine. And it's having those positive role models, which I think can help change some of the cowboy or machismo or, do it all attitude that we have in medicine.
Yeah, I think that's absolutely true, because the sense of, if I just work a little bit harder or a little bit longer, I will be successful at whatever it is, at a certain point does lead to burnout. Let me change topics very slightly and ask if you have any specific recommendations around health policies in Canada that could support and not oppose physicians coming forward with stress-induced illness. Is there something that you think on a systems level would be really helpful?
Short answer, yes. And multiple different levels. I think starting broadly, we need to continue to have these discussions. We need to have broad advocacy for physician health and wellness. And within the profession, we need to change our attitudes and change our culture to become more health-seeking and health-promoting. Physicians, medical learners, we need to have access to physician health programs, and access that isn't stigmatized in any way. We need to have policy changes at multiple different levels. And policy could be at a very macro level, so national level amongst our associations, amongst our colleges. Policies could be at sort of a meso level within the departments or hospitals in which we work. And I often think about some of the policies that are often termed more family friendly. And we talk about them in terms of helping women in particular, women in physicians. But when you really look at some of those family-friendly policies, they're really policies that are designed for everybody, that everybody could benefit from. Making, leave more accessible and less looked down upon, that's not actually a word, but less frowned upon. So leave to look after yourself. Not, oh, look at Osler, she's taking another 2 weeks of holidays. When does she ever work? No, it's, people taking holiday time that they've earned and accrued to look after themselves, to refresh their body and soul. I see a lot more of my colleagues having to look after not just children, but older parents as well. And those demands outside of medicine really can take a toll on somebody's health and well-being. If you've got a busy practice and busy career that you're really trying to balance, and outside of work, you've got young kids or older parents that you're trying to look after. So then you're constantly on the go and you don't have that time to refresh yourself. So a lot of the policy changes that could be had at hospital level, department level, health authority level could help all of us in terms of looking after our own health and well-being and integrating that work life. Look at accreditation standards. Could we have accreditation standards changed so that physician health and wellness or medical learner health and wellness is held as a standard by which that hospital or that training program gets accredited? Because those are the policy levers that we really need to recognize and use to hold the system accountable and to ensure that it truly is a shared responsibility between the individual and the places in which we work and train.
I agree with you, and I find it so interesting because in different industries, the culture is very different. A number of years ago, I spent a day learning about pilots and how pilots function. And one of the things that is part of the culture is that when there's a near miss with an airplane, it's reported in detail so that everybody learns what the problem was and how that can be prevented in the future. Whereas when there's a near miss in the hospital or with patient care, for the most part, there isn't that culture that says, let's talk about this. It's more, how can we compensate for this? How can we get past it? There's not that learning environment that recognizes some kind of a failure and says, okay, we all have to learn from this. And I think that's true with mental health as well. We don't necessarily have the environment where we talk about the fact that this environment, this setup, this system, this way we're doing things is creating difficulties, and how can we learn from that? We turn it back and say it's the individual, and okay, they need to fix their problem.
Yeah, getting away from the shame and blame culture and attitude is important. And I look back to when I was, an intern and a medical student and a resident, and you'd go to more mortality and morbidity rounds, and it would be mostly, a lot of not necessarily a lot of constructive, how can we do this better discussions were had. I think that I see it changing. So I have hope for the future, because I have been involved. And I think the collaborative team environments that we see now in a lot of hospitals helps, in that if there is something that happens, I'm seeing more and more team debriefs where people are allowed to talk about what happened, share perspectives, let some of those emotions go in a safe environment where the team really wants to learn about what happened so that we can do better the next time. So I am seeing some changes, certainly from when I was in my training in early days. And we need to keep that up, and we need to continue to have those types of discussions, debriefs, learnings, to move away from the shame and blame culture towards the how can we serve our patients better attitude.
And partly serving our patients is serving ourselves. We will do a better job if we're not doing that shame and blame, as you've discussed. So if we're looking at what we've discussed, if we're understanding some of the issues, what would be the sort of top one or two things that you would suggest for, say, the doctors you work with, or the trainees that report to you, or the supervisors that you report to? What would be the top one or two things that you think are the most important things that we need to learn from this discussion and learn from each other?
I think if I look at it from a colleague and a physician, the individual perspective, I would encourage everyone to continue to do what we are all doing to try to stay as healthy and well as possible. So both physically, emotionally, and mentally. We can't let up on that, because if we're not looking out for ourselves, if we're not looking out for our colleagues, there might not be anybody else doing it. So we need to keep that up. If I were to look at it from the system perspective, so if this is a shared responsibility between the individual and the system, I think those of us in positions of leadership, whether it's national, provincial, local, we need to continue to have these discussions to decrease stigma and normalize and encourage health promoting and health seeking behavior. And in those areas where we can have some change, where we can have positive impact, where we can change policy and procedures, we need to continue to do so. Because sometimes when we talk about changing the system, it sounds overwhelming. And you think, well, no, I'm just one person. What am I going to be able to do? When in fact, we make up the system. We make up the procedures and policies and rules by which that system operates. So we can change culture. We can change attitudes and behaviors. And we can find those levers, those policy levers, and those changes that need to be made to make physician health a priority. It's a core competency of who we are and what we do. And to not look after ourselves not only puts our own health at risk, but ultimately puts our patients' health at risk, because they're not going to be at their best if we're not at our best.
I think that's so true. And Gigi, Dr. Osler, thank you so much for being with me today. Thank you for sharing your perspective, for sharing your knowledge, for sharing your weakness for potato chips, but really for sharing your authenticity around the issues of mental health and wellness. I know you've done a lot of work on many levels, and at the same time, I think it's when I look at you as a colleague and I look at you as a professional, it's what resonates in terms of your own choices and your own understanding that I think helps others so much. I want to thank everyone for joining me on this call today. I think mental health is such an important issue, and hopefully this has been helpful to you in maybe lots of ways, maybe just in one simple way. If you want more information, please join us at therounds.com.